as a founding partner with a $275 million contribution. When the Coalition for Epidemic Preparedness Innovations was launched at the World Economic Forum in Davos in 2017 to develop vaccines against emerging infectious diseases, there was the Gates Foundation, with an initial injection of $100 million. The examples go on and on. The Bill and Melinda Gates Foundation's fingerprints can be seen on every major global health initiative of the past 2 decades. And beyond the flashy multi-billion-dollar global partnerships, the foundation is behind hundreds of smaller country and region-specific grants, $10 million to combat a locust infestation in East Africa, or $300 million to support agricultural research in Africa and Asia, that add up to billions of dollars in commitments. It comes as no surprise, then, that far beyond the $250 million that the Gates Foundation has pledged to the fight against coronavirus, every aspect of the current coronavirus pandemic involves organizations, groups, and individuals with direct ties to Gates funding. From the start, the World Health Organization has directed the global response to the current pandemic. From its initial monitoring of the outbreak in Wuhan and its declaration in January that there was no evidence of human-to-human transmission, to its live media briefings and its technical guidance on country-level planning and other matters, the WHO has been the body setting the guidelines and recommendations shaping the global response to this outbreak. But even the World Health Organization itself is largely reliant on funds from the Bill and Melinda Gates Foundation. The WHO's most recent donor report shows that the Bill and Melinda Gates Foundation is the organization's second largest donor behind the United States government. The Gates Foundation single-handedly contributes more to the World Health Body than Australia, Canada, France, Germany, Russia, and the UK combined. What's more, current World Health Organization Director General Tedros Adhanom Ghebreyesus is in fact, like Bill Gates himself, not a medical doctor at all, but the controversial ex-Minister of Health of Ethiopia, who was accused of covering up 3 cholera outbreaks in the country during his tenure. Before joining the WHO, he served as chair of the Gates-founded Global Fund to fight AIDS, tuberculosis, and malaria, and sat on the board of the Gates-founded Gavi, the Vaccine Alliance, and the Gates-funded Stop TB Partnership. The current round of lockdowns and restrictive stay-home orders in Western countries were enacted on the back of alarming models predicting millions of deaths in the United States and hundreds of thousands in the UK.
Imperial College in London released a COVID-19 report, and that's where most of our U.S. leaders are getting the information they're basing their decision-making on. The report runs us through a few different ways this could turn out depending on what our responses are. If we don't do anything to control this virus, over 80% of people in the U.S. would be infected over the course of the epidemic, with 2.2 million deaths from COVID-19. That 2.2 million deaths also doesn't account for the potential negative effects of health systems being overwhelmed.
From this evening, I must give the British people a very simple instruction. You must stay at home.
Enough is enough. Go home and stay home.
A statewide order for people to stay at home.
The work of 2 research groups was crucial in shaping the decisions of the UK and US governments to implement wide-ranging lockdowns, and, in turn, governments around the world. The first group, the Imperial College COVID-19 Research Team, issued a report on March 16th that predicted up to 500,000 deaths in the UK and 2.2 million deaths in the US unless strict government measures were put in place. The second group, the Institute for Health Metrics and Evaluation in Bill Gates' home state of Washington, helped provide data that corroborated the White House's initial estimates of the virus effects, estimates that have been repeatedly downgraded as the situation has progressed. Unsurprisingly, the Gates Foundation has injected substantial sums of money into both groups. This year alone, the Gates Foundation has already given $79 million to Imperial College, and in 2017, the foundation announced a $279 million investment into the IHME to expand its work collecting health data and creating models. Anthony Fauci, meanwhile, has become the face of the US government's coronavirus response, echoing Bill Gates' assertion that the country will not get back to normal until a good vaccine can be found to ensure the public's safety.
If you want to get to pre-coronavirus, that might not ever happen in the sense of the fact that the threat is there, but I believe with the therapies that will be coming online and with the fact that I feel confident that over a period of time we will get a good vaccine, that we will never have to get back to where we are right back now.
Beyond just their frequent collaborations and cooperation in the past, Fauci has direct ties to Gates' projects and funding. In 2010, he was appointed to the Leadership Council of the Gates-founded Decade of Vaccines project to implement a global vaccine action plan, a project to which Gates committed $10 billion of funding. And in October of last year, just as the current pandemic was beginning, the Gates Foundation announced a $100 million contribution to the National Institute of Health to help, among other programs, Fauci's National Institute of Allergy and Infectious Diseases research into HIV. Also in October of last year, the Bill and Melinda Gates Foundation partnered with the World Economic Forum and the Johns Hopkins Center for Health Security to stage Event 201, a tabletop exercise gauging the economic and societal impact of a globally spreading coronavirus pandemic.
It began in healthy-looking pigs, months, perhaps years ago. A new coronavirus.
The mission of the Pandemic Emergency Board is to provide recommendations to deal with the major global challenges arising in response to an unfolding pandemic. The board is comprised of highly experienced leaders from business, public health, and civil society.
We're at the start of what's looking like it will be a severe pandemic. And there are problems emerging that can only be solved by global business and governments working together.
Governments need to be willing to do things that are out of their historical perspective, or for the most part, it's really a war footing that we need to be on.
Given the incredible reach that the tentacles of the Bill and Melinda Gates Foundation have into every corner of the global health markets, it should not be surprising that the foundation has been intimately involved with every stage of the current pandemic crisis either. In effect, Gates has merely used the wealth from his domination of the software market to leverage himself into a similar position in the world of global health. The whole process has been cloaked in the mantle of selfless philanthropy, but the foundation is not structured as a charitable endeavor. Instead, it maintains a dual structure. The Bill and Melinda Gates Foundation distributes money to grantees, but a separate entity, the Bill and Melinda Gates Foundation Trust, manages the endowment assets. These two entities often have overlapping interests, and, as has been noted many times in the past, grants given by the foundation often directly benefit the value of the trust's assets.
One of my favorite parts about my job at the Gates Foundation is that I get to travel to the developing world, and I do that quite regularly. My first trip in India, I was in a person's home where they had dirt floors, no running water, no electricity, and that's really what I see all over the world. So in short, I'm startled by all the things that they don't have. But I am surprised by one thing that they do have: Coca-Cola. Coke is everywhere. In fact, when I travel in the developing world, Coke feels ubiquitous. And so when I come back from these trips and I'm thinking about development and I'm flying home and I'm thinking, well, we're trying to deliver condoms to people or vaccinations, Coke's success kind of stops and makes you wonder, how is it that they can get Coke to these far-flung places? And if they can do that, why can't governments and NGOs do the same thing?
And the charity of Microsoft founder Bill Gates and his wife Melinda is under criticism following the disclosure it substantially increased its holdings in the agribusiness giant Monsanto to over $23 million. Critics say the investment in Monsanto contradicts the Bill and Melinda Gates Foundation's stated commitment to helping farmers and sustainable development in Africa.